So today we're going to be talking about CAUTI prevention. And so what is a CAUTI? As healthcare professionals, we know what a CAUTI is. It's just a UTI caused by an indwelling catheter or the insertion of an indwelling catheter. So out of all hospital-acquired infections, the CAUTIs cause approximately 40%, and of the 40%, 80% are caused by the indwelling catheters. And then also indwelling catheters, every day that it is inside of a patient, it increases their risk for infection 3 to 7%. And so the objective of the PowerPoint and the presentation is to decrease the number of CAUTIs through assessment, education, and proper hygiene. And so the PICO question is, for patients on a neurology unit with continuous assessment for the need of an indwelling urinary catheter and using cleansing wipes to clean catheters, reduce the number of catheter-associated urinary tract infections. And so what a PICO question is P stands for population, which is patients on a neurology unit. I stands for intervention, which would be the assessment and the cleansing techniques. C would be comparison, so really you're comparing what we already do compared to what we have in the presentation. And then outcome is to have a decreased number of CAUTIs. And so signs and symptoms of a UTI, pretty basic. You have pain and burning in the lower abdomen, fever, burning during urination, increased urinary frequency, and increase in WBC. So really, with people who have indwelling catheters, you're only going to see pretty much the lower abdominal pain, the fever, and the increased white blood cell count while the catheter is in place, because they won't really have the other symptoms until the catheter is removed. And then CAUTIs result in, they cause an extended hospital stay, and it's estimated 2 to 4 days, but it really depends on the predisposing factors, what they already have before they come in. Also, it increased healthcare costs. So estimated per year is about $250 million that hospitals have to pay for CAUTIs because Medicare and Medicaid do not reimburse for them. And then also is increased patient morbidity and mortality. So patient outcomes are decreased due to the CAUTIs because some people will end up septic. Like I said, it really depends on what the predisposing factors are. So what can prevent it? Assessing the need for a catheter. And we have a small assessment in the Meditech system. It doesn't go into a lot of detail, and so really revamping that and making it more patient-oriented to where you really determine the need for it. Also, proper catheter care. And I'll go into a little bit more detail as far as some research that was discovered, but using cleansing wipes instead of bath basins because bath basins actually increase the exposure to bacteria. And then proper hand hygiene. Hand hygiene is the #1 preventative measure against infections. So really, when you are any kind of contact with the patients, wash your hands before and after. Don't be naughty, prevent CAUTI. Assessing the catheter need. So there was some research done, and it was followed the Houdini guideline. So if the patients met these certain guidelines, then they could actually be a candidate for indwelling catheter or keep that indwelling catheter. So hematuria, obstruction, urologic surgery, decubitus ulcer, monitoring intake and output, and then no code comfort care, and then also immobility due to physical constraints. And so also in one of the research studies, it found that having reminder systems on the computers, not just for nurses and healthcare professionals, but also the physicians to reassess that need, and if it's not needed anymore, write an order to discontinue it. If it still is needed, write an order to continue it. So then some kind of measure is done to ensure that it is being checked. Cleansing techniques. So bath basins were pretty much the worst thing to have for catheters because you don't really change the water every time you dip a clean rag in there. We do use different rags for each type, but the water is still the same. So it really increases that amount of exposure to bacteria. The CHG wipes, actually, a lot of the nurses liked it in the research study. However, they're more expensive. So they're pretty much the same as the plain cleansing wipes, just the plain cleansing wipes are more cost efficient. So pretty much the same though. They do decrease the amount of exposure. However, the CHG didn't show any extra decrease prevention. So what can we do? Question the need of the catheter every day, and then also ensure proper drainage to the catheter bag, because bacteria really grows in the tubing. So when there's backflow, then that bacteria goes into the patient. Then also clean catheter daily and when soiled. That way you try to keep that area clean. And then proper hand hygiene, as we discussed earlier. And then also inserting the catheter using aseptic techniques. So even if you think that you might have broke sterile fill, go ahead and throw everything away, start over. It'll benefit you and the patient. So what does result in decreasing CAUTIs? So it decreases hospital stays, as we talked earlier, how it can affect that. And that can increase patient outcomes and increase patient satisfaction. And we know we have the patient satisfaction surveys go out all the time. And it also decreases hospital costs. And so if you think $250 million a year, that could actually come back to the employees as raises and bonuses. So these things that we can prevent can really benefit us in the end. And so when we get raises and bonuses, we're happy, and so the turnover rate is reduced. So how does it affect our unit? Well, our patients either have traumatic brain injury, had some kind of spinal surgery or neurosurgery, and so we have a lot more patients that would require a Foley catheter or an indwelling catheter. So the best thing is to decrease the catheter days and also the number of actual Foley catheters that we use. Because again, it'll affect surveys and outcomes for the patients. So how do we evaluate it? Meditech would need a little bit of tweaking. We can actually determine the amount of catheter days now, because we have to put the insertion date and then the DC date of the catheter, so we can kind of determine how many days the average for each patient. But a little bit of tweaking determine how many actual UTIs are caused by the indwelling catheters. So that way we can kind of keep track with a generated report from Meditech to determine exactly our numbers. So we can find out what we're doing wrong or what we need improving on. Also, look at the patient satisfaction surveys that are mailed. So that way we can kind of determine what we can do better as far as in relation to the CAUTIs. Because, some patients are like, get this thing out of me as fast as you can. So, sometimes they'll put different stuff on the surveys. So, in conclusion, reducing the number of CAUTIs will decrease hospital stays, decrease the hospital costs, which in turn might increase raises and bonuses for us, and then it also increases patient outcomes and patient satisfaction. Keep calm and prevent CAUTIs. Anybody have any questions that y'all can think of?
No, I don't think so.
Okay. And then these are just some of my references that I used. Alrighty. Thank y'all.
Thank you. Good job. I'm taking everybody's Foley out.